Dr. Donna Balewick is with us this morning. Dr. Balewick will be putting on a program next Tuesday called Stroke, a Community Perspective. It'll be happening at the Rustic Lodge at 6 p.m., all about the fact that stroke is a really, really big part of should be a big part of everybody's consciousness right now. IRMC is a primary stroke center, and good morning to you. This is a really big and important program, isn't it?
It is.
Yeah. Okay, so tell us about how you're going to structure the program, what people need to know about stroke.
The program is structured as kind of a lecture and discussion, and we'll be talking about how frequent stroke is, because it's not an uncommon disease. It's, in fact, the third leading killer of Americans behind heart disease and cancers. And we're going to talk about risk factors, what we can do to modify our risks. We're going to give a telestroke demonstration because we're changing some of the ways we examine patients and have neurology follow-up, and one of them is telestroke. Lots of hospitals do telemedicine, and so we'll have a telemedicine demonstration on how to do it. And it's very interesting, great technology. It won't surprise anybody, but I think people should see it.
Yeah, and I would guess that in a rural setting such as Indiana County, telestroke would be a pretty important tool to use.
It is an important tool, and it's going to be a more important tool as other specialties. If we can't get specialists to come to us, we're going to go to them via the technology that we have, which is pretty great.
Okay. So IRMC is a primary stroke center. This program's coming up Tuesday at 6, and in sort of a preview form. What is stroke? What are the types of stroke that people can have, and why do people become at risk of stroke?
So think of stroke as a brain attack. Everybody's very familiar with heart attack and call 911, and when people get chest pain, they don't hesitate to come to the emergency department or seek medical care. But a lot of times when people have symptoms they can't explain, a numbness, a blurry vision, they kind of want to wait and see if it gets better. And we're trying to encourage people to treat it like a heart attack. Seek attention immediately, get the diagnostic testing that needs to be done. And if we find nothing, great. But if we find something, you're in a position to treat it if you come in sooner rather than later.
Mm-hmm. Okay. All right. So what are the things that we're looking for?
So things that we're looking for when people have, for example, weakness or clumsiness in a hand, double vision, they can't speak suddenly, they need immediate medical attention. It's not something to wait around. There's different kinds of stroke. There are strokes from hemorrhages inside the head. There are strokes from blood vessels just getting too small over time. And then there are strokes from a blood vessel getting acutely clogged. And different things put us at risk for those.
We're aware of the acronym FAST.
Yes.
What does that stand for?
Well, it's for the facial, asymmetry, weakness in hands, not being able to talk. And so we have people, smile, grimace, stick your tongue out, say a few words, and put your hands up in the air and see if they fall. And that's just kind of a very quick screen.
Okay. And the really important thing is that when you suspect a stroke, don't fool around. Don't
fool around. Correct. Mm-hmm. Treat it very seriously. It's time is of the essence for certain ones. There are clot-busting drugs, very potent blood thinners that can break up a clog to the brain, and you're not a candidate if you wait 24 hours. You have to have that done very quickly, or the risk of the blood thinner is actually greater than the risk of the disease.
Mm-hmm. You spoke when we began talking here this morning about stroke being a killer.
Yes.
And certainly it is.
Yes.
But stroke also has the ability to affect those who survive the stroke in major ways for the rest of their lives, in their terms, their ability to communicate, get around, pick up things, just to do the general things that normally we would do. Now we can't because we've had a stroke and we've suffered those effects.
Yes.
Correct.
About a third of patients that have strokes die very acutely. A third recover completely, and a third are left with varying degrees of disability, which can range from a hand that doesn't work well, or the inability to speak, or being paralyzed on a side. And that's a great disability and loss of function, and it can happen at a young age.
Yeah. I would guess as well that for folks who tend to live alone and not be around a lot of people, this becomes really, really risky.
It is very risky.
Yeah.
It's very risky. I think I try to encourage people, if they live alone, to have something like one of those life alert buttons that they can call for help. But loneliness and living alone is also a risk for stroke, and we talk about that in the lecture, that community is very important on so many levels than just somebody to have lunch with.
We're talking with Dr. Donna Balewick this morning. She's the Medical Director of Emergency Services and Acute Care Services at the Indiana Regional Medical Center. And on Tuesday at 6 p.m. at the Rustic Lodge, she's putting on a program called Stroke, a Community Perspective. So we've talked about some of the signs that we look for, the risk factors for stroke. What are some of the ways we can reduce some of the major risk factors in our lives?
So risk reduction involves lots of things. We can't pick our parents, can we? We can't pick the color of our eyes. So some of our risks are genetic, and those can't be, we can't change those, but we can modify our risks. We can choose our habits. Smoking is a huge risk. And they've shown in the United Kingdom that when smoking was eliminated, for example, in bars and pubs, smoking rates went down all over, and heart attack and stroke rates went down, almost immediately. Yeah. So smoking is a huge risk for stroke. Diabetes is a risk, hypertension is a risk, and a lot of people are very concerned when their blood pressure goes up all of a sudden, a one-time elevation, and that's not likely to cause a stroke. Mm-hmm. However, persistent elevations in blood pressure put you at risk for hardening of the arteries and gunking up your pipes, basically, and then that's a risk later on.
So one would think then that what you're saying is reducing those risks. Smoking is an easy thing to say, okay, I need to cut down and eventually quit. Managing diabetes, and things like the blood pressure and
cholesterol as well.
And they all have to do with fitness and diet, don't they?
Yes, they do.
Yeah. And those obviously are ways to reduce your risk.
They are ways to reduce your risk,
of having a stroke. All right. Well, folks are certainly going to learn much more when they visit with you on Tuesday, 6 p.m. at the Rustic Lodge. And by the way, 357-8088 is the number to call to register. It's going to be a free event. I'm really interested in that telestroke discussion that you were talking about earlier. That sounds like a really great advance, I guess, in the way that we handle stroke or other emergency situations.
I think it is. The technology, every kid that has a good phone can tell you that you can FaceTime somebody and actually see quite well what's going on. And this is kind of a super duper camera and easy for those of us that are not technologically sophisticated to operate. And with the use of a laptop on the other end, we can go through a neurological exam, and the neurologist can follow the eyes and see the pupils react, and listen to the patient answer questions that shows that they're thinking correctly, that they're processing, that they're saying words correctly. A good neurological exam takes a few minutes, but is the most important thing besides a scan.
Yeah. What does the designation as a primary stroke center mean in terms of IRMC?
So at IRMC, we can see patients acutely for stroke. There's been a push to take patients to designated stroke centers, so we can offer immediate neurological consultation either in person or by telestroke. And then we can also give the thrombolytics. It's called TPA is the one we use, and it's a medication that's a clot-busting drug. We use it, and we can actually admit patients directly from that, or if they fit different categories, which is really up to the neurologist, refer them to a tertiary center like a UPMC that can do, or Allegheny General that can do clot retrieval if the patient meets those criteria. Okay. But we can take care of them immediately.
Yeah. It really is a big deal, isn't it?
It is a big deal, and it's a wonderful coordination and collaboration with EMS. Those folks that see the patients in the field do a very good job in saying, I think this person's having a stroke, alerting us ahead of time so that we have all the resources available the minute the patient comes in. Yeah.
One thing I didn't cover or ask you about was, who gets stroke. There really isn't an age limitation on that, is there?
There is not. There is not. Children can have strokes. Adults can have strokes. Yeah. We think more of adults because of the risk factors, and certainly that's the predominant form we see, but children can have strokes as well.
Yeah. She's Dr. Donna Balewick again. The program is Tuesday, 6 p.m., Rustic Lodge. Stroke, a community perspective. Call 357-8088 to register. It is absolutely free. And as you can see, you're going to learn a lot. You're going to learn a lot at this presentation. But while I have you here, I want to ask about measles. Because that's the big raging topic, especially since there were 5 cases in Allegheny County.
I think there's more already.
Oh, boy. Measles. We suspect we might have it. What do we do? We don't show up at the ER. That's not the thing to do, is it?
It's really not. Measles is a viral illness and will come in all forms, from very benign to making people very sick. Mm-hmm. I think that just like with stroke, prevention is everything. And in measles, we have a prevention. We have, immunizations. And I'm not understanding the reluctance to get children immunized, or adults. But I think that it's a viral illness, cough, red eyes, watery eyes, and then there's these particular spots inside the mouth that are that show it. Mm-hmm. If somebody does show up with measles, we're going to isolate them in the emergency department. The difficulty with the virus is that it can remain active in the air for several hours. And that's the real contagion with it. And frankly, the communities that are not well immunized put other people at risk that can't get shots. Children that have had transplants, adults that have had transplants, it really puts them at risk for getting a very serious illness. Yeah. So somebody who's concerned that they might contract measles, first of all, it's easily defeated with the vaccination. Correct. Yes. It's easily prevented, yes. Yes. So and the vaccine is safe. If somebody does suspect that somebody that they've been around has it, what should they do? Should they call somebody, call their primary care? They should call their primary care and see what their shot record shows. Not too many people carry around their shot records to know that they're immune or not. Yeah, especially if you get up in years and those records are no longer available to you. Correct. Change doctors. Like everybody, at some point we get to the point where the doctor who's cared for us most of our life retires, and we have to get a doctor who's younger than us, which is very traumatic. It's just the way it is as we age. Yeah. We just try to do it as gracefully as we can. Yeah. Some are more successful at that than others. But there you go. Call your primary care physician if you suspect measles. If you don't know that you've had a vaccination, go get one. Doesn't hurt to get another one. Absolutely. Doesn't hurt. Very good. Very good. Thank you so much for coming in. We appreciate it. Thank you. She's Dr. Donna Balewick. Stroke, a community perspective, Tuesday, 6 p.m., Rustic Lodge. Call 357-8088 to register. Coming up at the top of the hour, just a few moments from now, it'll be Fox News. And then Josh Whittison is in our WC